The United States reported record-high COVID-19 cases and hospitalizations over the weekend, amid a warning that the virus could gain even more of a foothold during the upcoming Thanksgiving holiday and the winter season. The incoming Joe Biden administration has been preparing to tackle the pandemic from day one of the president-elect's term, rolling out measures to contain the virus across America and also recommit to the World Health Organization's efforts to coordinate a global response to the pandemic. We discuss these developments and the challenges ahead with Dr. Bruce Wiley, Professor of Health Policy and Management at City University in New York and Senior Contributor for Forbes. It's lovely to see you again.
Great to be here, Sia.
And joining us from the UK is Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School. Thank you for being on the show again.
Thank you for inviting me.
Well, let's start with you, Dr. Lee. Now, first of all, with the Joe Biden COVID-19 task force getting ready to tackle this pandemic from day one, do you approve of what he's been doing so far? And do you think the president-elect will be able to push through his plans, such as making masks mandatory and implementing the Defense Production Act?
Well, a key difference is that the president-elect, Joe Biden, is acknowledging that the pandemic is a very serious problem and is just by forming the coronavirus task force so early, he is acknowledging that this is an important thing to tackle as quickly as possible. So that's been very positive, and also making sure that there are medical experts on the task force. But currently, there's still a lot more to be done. There are more experts to be added. There's more expertise to be tapped, and they'll need to develop very specific plans going forward. So it's still fairly early, but the initial signs are positive.
Dr. Lee, unfortunately, it looks like the White House under the Trump administration isn't planning to work with the Biden transition team on COVID-19 or resume their regular public task force news conferences. So how is this really affecting public messaging, and what dangers could this pose with the upcoming Thanksgiving holiday and also the Christmas season?
Yeah, that's very problematic because currently Joe Biden is the president-elect, so he's not the actual president, and he doesn't run the administration. So they don't have decision-making power currently. So currently, we still have Donald Trump as the president, and his administration is the administration that's supposed to be responsible for handling the current pandemic until January 20th, which is Inauguration Day. So it's really important for the current administration to work with and cooperate with the incoming administration. We need to put aside political differences right now, because right now is a very critical time. We're seeing cases surge in the United States. We're seeing record numbers of new cases each day, especially given the fact that the temperatures are going down, the humidity is going down, activities are moving indoors, which is a setup for continued surges in not just the number of cases, but ultimately hospitalizations and deaths. So ultimately, we have to make sure that that information is transferred over to the incoming administration as quickly as possible.
Right, and some are calling this a third wave. And Dr. Pankania, well, right now it seems infection cases in both the US and the UK, they seem to be spiraling out of control and spreading much too quickly for testing and tracing efforts to keep up with. I mean, both countries have kind of failed to deploy their tracing apps. And, well, what do you think needs to be done to ensure that hospitals at this point aren't overwhelmed?
So the number of cases that are going to be generated in the next few days have already been created because they will have been exposed and they are only waiting to become cases. Going forward, nevertheless, what is important is the actions of every individual. When every individual takes actions to prevent themselves from not getting infected and not infecting other people, this has a multiplier effect, a positive multiplier effect, and hopefully case numbers will be kept down. The other advantage that we now have finally is that we've gone into lockdown number 2, and by going down into lockdown number 2, hopefully, and it is only a hope, that people will not get infected and infect others. So that should also stabilize and hopefully bring down case numbers. Having said all this, the most important thing is that every individual tries their best not to get infected and not to infect others. It is not always possible because people have to go to work, children are going to schools, and businesses are open. It is not a total lockdown. So it is a tough order. It will be a tall order. We all can do our own contribution by having good infection control measures, like wear a mask and wear it properly.
Right, and these kind of principles, they're universal really wherever you are in the world, here in South Korea as well. And Dr. Pukanya, rejoining global efforts to fight the pandemic, Joe Biden is planning to undo outgoing President Donald Trump's withdrawal from the World Health Organization, in addition to other pledges like making masks mandatory and ramping up testing and the production of necessary equipment. Do you see this action plan as a welcome development? And what do you hope to see from the US in rejoining the global effort to fight COVID-19?
So in one nutshell, this is very good news. The United States is a very powerful economy and a big influencer, and therefore it should not be absent from the big table of the World Health Organization. If it has difficulties and disagreements with the WHO, it is better to sit at the table of the WHO and iron out those difficulties. To sulk away and say, I withdraw from the WHO is not showing good leadership. Therefore, it is really good to see President-elect Biden saying he will rejoin WHO because, to be truthful, the benefit is both to the United States and to the rest of the world. So if coronavirus COVID-19 disease is out of control in the rest of the world, it will also be out of control in the United States. So actually, President-elect Joe Biden is helping both the world community as well as the United States community. It is to be welcomed, and I'm very happy that he's going to do this. It is a ray of good hope.
Right, very hopeful news for the world. And Dr. Lee, we also heard that Pfizer's vaccine candidate has a 90% efficiency rate. And of course, most of the world has been very optimistic about this. But then no mRNA vaccine or drug has ever won approval before. So for the average person, it does sound a bit worrying for people who aren't medical professionals. So is it okay to be optimistic about this? And what else do you think would have to be verified before it is FDA approved?
Well, so the announcement earlier this week from Pfizer is encouraging. So it's positive news, it's encouraging, but we have to keep it in perspective. These are very preliminary results from just a few months of testing in the clinical trial. So we have to keep in mind several things. So number one, that it was an announcement from Pfizer. The data still needs to be reviewed by the scientific community to confirm the findings and determine what the limitations might be. Results from a fairly short period of time, while encouraging, are not enough to make clear statements about vaccine effectiveness. We have to keep in mind that it's not just how many people happen to develop infections over time, but how long people can remain protected. So basically, the trial involves putting two groups of people and then determining, half or one group of people get the vaccine and one group gets the placebo, and determining if there's a difference in the infections that have evolved. And that's basically what these initial results from the first few months have shown. But we really have to wait a little longer to see how effective it may be and look into the safety of the vaccine as well. But these are encouraging. Now, you mentioned the mRNA vaccine. This is a new technology. It's not similar to existing flu vaccines or other types of vaccines, which use either parts of or the entire virus that's been inactivated or weakened. This is specifically using the mRNA. So this has very different storage requirements, and so first of all, it has to be stored in sub-zero, very deep freeze conditions, like -80, -90 degrees Fahrenheit. And plus, given that it's a new technology, we really need to be careful and make sure it's well tested. So one of the key things is to make sure that the vaccine goes through the standard steps of testing. We can't rush that. So the Food and Drug Administration, the FDA, can't take shortcuts and really needs to go through the whole 9 yards to make sure this vaccine is safe. So I'd say, this is encouraging, but we should make sure that all the regulatory review occurs, and we should make sure the scientific community has a chance to review all the results.
Oh, so a very stringent review and approval system there is needed. And Dr. Pankania, reports say that 80% of Pfizer's vaccine stocks have already been procured by very wealthy countries. But then where does this leave developing nations? I mean, the World Health Organization's COVAX, it aims to supply enough vaccines for at least 20% of the member countries' populations. But is this enough, though, for low-income countries which really lack adequate medical facilities?
I wouldn't worry about it. I never imagined that Pfizer would supply the world, and to be truthful, it shouldn't. The vaccines produced by Pfizer, as our colleague in New York has just said, they require minus 80 degrees centigrade freezing to keep it viable. It is a complex vaccine that needs also complex refrigeration and cold chain management. I expect that the 11 candidate vaccines that are in the phase 3 trials will also be successful, if not all 11, at least 5 or 6 of them. And those successful trials of the Russian, the Japanese, the Chinese, the Indian vaccines will also be useful, and the United Kingdom one, not to forget this. They will also be useful to supply and to immunize other parts of the world. So I'm not worried that if you're not going to get the mRNA from Pfizer, that you won't get anything. Of course you will in time. I just look forward to other vaccines from the other groups also coming online very shortly.
And well, gaining access to a working vaccine is the first challenge, of course. But after that, in addition to the supplies of vaccines, how else should developing countries be supported to be able to actually facilitate fast and effective distribution?
Well, they need assistance from the World Health and other communities with respect to logistics, with respect to data, with respect to recording, and enabling not only the delivery of the vaccine, but administering the vaccine and good record keeping, because most of these vaccines have never been tried before, and therefore it is very important that we actively monitor, record, and watch the people after they have been given the vaccines to follow it up and look for any side effects or any untoward reactions to the vaccine. Therefore, all this logistic help has to come from other more developed nations and the World Health Organization and other world organizations at the same time to enable this safe delivery of vaccines to all parts of the world. Because look, really, the most important message is this: no country is an island on its own. Therefore, in your own private personal interests is you need to look after your country and other countries. And when you look after other countries and your country at the same time, the number of cases globally come down and we'll all be in a better place. So it is almost your duty to look after both your country and other countries.
Well, in the meantime, news of a vaccine is really boosting optimism, well, all across the world. But then, Dr. Lee, surveys conducted in the UK and the US, they show that a significant portion of the population are rather skeptical of vaccines, and many of them don't believe that the COVID-19 vaccine will be safe because it's being developed in record time and there's been all this politics surrounding it. Then what do you think should be done really to regain that public trust, as well as get more transparency from vaccine developers, most of whom are being funded with public money?
Yeah, it is a challenging, it's a big challenge since, first of all, even before the pandemic, there are many well-established vaccines out there, the flu vaccine each year, childhood vaccines, et cetera. And even though those have been very well tested over many years, have great safety records, there's still the anti-vaccination movement that has been trying to erode confidence in vaccines. So that's one challenge. And then on top of that, as you mentioned, there are concerns that the vaccine is being rushed too quickly through the regulatory process. So several things need to happen. Number one, there has to be very, very clear transparency when it comes to developing and ultimately manufacturing the vaccine. There can't be any suggestion that any of these crucial steps, like reviewing the data, making sure the scientific community has reviewed the data, looking at the safety data, making sure it's safe and effective, we have to make sure that those steps are not skipped. They need to be very clear, very transparent, and communicated to the public. So this way, there is a unified message. And the vaccine should, once they're available and ready, everyone needs to be on the same page in terms of safety and efficacy. If there are questions or doubt, those need to be resolved before the vaccine ultimately reaches the market. So this is the time right now. This is the time to make sure that the trials are being done well. This is the time to make sure that any questions are being asked, answered. This is the time to make sure that the scientific community has full access to all the results. And then once any of these vaccines are available, it needs to be clearly communicated what the expected effect will be. Because we have to remember that there are a number of different effects that the vaccines may have. Some vaccines may prevent infection. Some vaccines may prevent more severe disease. Some vaccines may potentially cut short the length of disease, but you still can develop disease. Some may reduce the amount of shedding, in other words, the amount of virus that you may transmit. So we have to be very clear about what the vaccines can actually do. The other misconception I'm seeing is that, well, once we have a vaccine, we'll be able to return completely to normal once the vaccine is available. But we have to keep in mind that there are all types of vaccines. They may have different levels of protection. So for a vaccine to allow everyone to return to normal, meaning pre-pandemic, that vaccine has to have a very, very high effect. And we may not get that. That doesn't mean a vaccine is not useful, but we have to be very clear about what the vaccine can actually do. So we might have a situation, very, very probable to have a situation where a vaccine comes out, you still have to maintain a lot of these precautions for a while. But the vaccines that would definitely be helpful. It may not be the cure-all.
So we have to keep doing what we have been doing all along, just continuing to practice the social distancing and safety guidelines. And I'm afraid we're out of time today, so this is where we're going to have to wrap up the discussion. That was Dr. Bruce Wiley, Professor of Health Policy and Management at City University in New York and Senior Contributor for Forbes, and Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter's Medical School. Thank you both so much for your time.
Thank you.
Thank you.
And to our viewers, thank you for watching.